Hey guys, it's Dr. Matt with your medical practice mentor, and this is part 3 of our 3-part series on creating an owner's mindset in your practice. So remember, in the success journey, this is the 3rd milestone to achieving a successful hybrid cash and insurance-based practice. So what we want to look at today is introducing incentive compensation to your team. And this has been very profound for our organization. And when we did this, it was a bit scary, but once we did it, and it is always a process, but we've been doing it for well over a year now. It has gone much better for our therapists, our doctors, and they are earning more income, they have more control, and it has improved the just efficiency of our organization. So, for example, with the leadership team, we had to really first rally together, sense the urgency of the importance to do this in order to really thrive as a practice, to get our team, our therapists, on board with this idea of going to a per patient or per unit visit, and coming up with a plan, a strategy aligned to roll this out. And then the business team, they had to look at, okay, what are the current revenues that our clinicians are producing, and setting targets that are attainable, not too difficult, so that the staff can experience a win, meaning increased income, and also improving the systems in the clinic in terms of efficiency. Simple things like making sure they have all the tools that they need to treat their patients effectively. Having someone that is not a clinician bring the patient back, have them all ready for the doctor, the therapist, to get right into delivering billable procedures. Making sure we have laundry, making sure that the layout is conducive to improving the flow of patients without reducing the quality of time and care of the guest. And then we looked at the marketing team. The marketing team, our sales and marketing team, really had to make sure that we are very consistent with our marketing. We hit over 150 doctors every month, and we do get between 80 and 100 referrals a week. And we use HubSpot as our infrastructure to record all our marketing calls, and we rank all our referrals by in levels 1, 2, and 3. And so we really focus on the low-hanging fruit, making sure that we are really making headway with our marketing. And then last but not least, of course, is the clinical team. I mentioned already, but making sure that they have the tools, listening to the frustrations that they may have, looking at the top producers and determining how is it they do so well, and kind of deconstructing how they do well, and then helping them help the other therapists. Also giving them goals and a tool, a little spreadsheet to track their results and to determine, okay, what is my financial goals? To create budgets for themselves at home and financial goals so that they know what they need to hit to obtain their own personal financial goals at home. So guys, I highly recommend this compensation structure. As a matter of fact, it must be done. You have to do it to really scale and grow your practice. Well, thank you for joining me, and we will see you next. I have a 3-part series coming up on when change fails. So look forward to bringing that to you over the next several weeks.